Julian Entwistle, and I've been asked to chair this session on the Oxitec technology. I'm from Xenix Associates. You'll see some information about us in your book about the ISNTD. We're a consultancy in the vector management space. So Andy has already given us an introduction to the Oxitec technology and explained it in broad terms. And now this is the opportunity to go into some more detail and to maybe address some of those questions that you might have in your mind. So he's going to go into some more depth about how you deliver a riddle, as it's called, Oxitec approach to controlling the Aedes mosquitoes and some specific examples. So going into more depth and detail related to what he was talking about this morning. And then we'll touch on this community engagement. If you remember the three elements to it, there's the actual technology, the community engagement, and the regulatory piece. So we're fortunate also to have Camilla Beach, who's the Oxitec regulatory manager, and also Hayden Parry, who's the chief executive of Oxitec here. So what we'll do is run through for about half an hour, if we can keep it down to half an hour, I think, in terms of explaining more about the approach, and then we can have some time for discussion and questions after that. Okay, over to you, Andy.
Great, thank you. Thanks for coming along. So as I mentioned before, we've been testing this technology in the field for about 4 years. The first open release was in 2009, and we've subsequently done a series of tests of increasing scale and complexity. And I believe, we're really now moving on from this initial research and development phase to scaling up to operational size. Can you actually get this technology working on a large scale basis? And so I just want to run through that and explain a little bit about some of the results, but also focus on how we would approach using this technology in a large scale program. So, as Julian was just alluding to, I'm going to focus on this technical side, but it's very important to mention both regulatory and community engagement. Those are both key elements to bringing this sort of technology out of the lab and into the real world. In terms of regulatory, Camilla's here and she can answer more questions after my talk. But just to point out that in all the countries we're working with specific regulatory committees in those countries, and we're also working with some sort of international policy-type regulatory bodies, because it's such a new field. We are pioneering the way in the use of genetic insects. This map shows the red stars are areas where we've done open releases, and the yellow stars are areas where we're in the process of going through regulatory applications for trials. Community engagement, this is key. We're working with communities, we're having to go in there, do monitoring, trapping, releasing mosquitoes. Now that's a counterintuitive thing unless you understand the technology, unless you understand that what you're releasing are males and they don't bite and they don't pose a risk. So it's essential that we're able to get this message across. And we'll use all kinds of media, TV, radio, blogs. In Brazil, a popular method of getting messages across is cars drive around with loudspeakers, so we use that in Brazil. A lot of face-to-face work, so when the field teams are out doing the monitoring, they have lots of opportunities of talking with the people and understanding concerns and being able to allay those. So now moving on to sort of the release strategy. I've broken this down into 4 sections, how you would approach a riddle or Oxitec control program. The first phase is preparation. This is preliminary, pre-release, monitoring, preparation. Then you have an intervention phase, And this is all about bringing down the population, and you'd release the mosquitoes, male mosquitoes, at full release rate. And this is where you break the back of the population, and normally takes between 4 to 6 months to achieve substantial control. We then move into a cleanup phase where you have a reduced release rate, and this is more about just mopping up the last of the population. And when you've got good control of the population, then you can move into the maintenance phase, which is all about maintaining that low population and stopping resurgence. So I'll expand a little bit on each of those. So preparation, every area I work in is different. You know, some of the public health authorities have excellent mapping, excellent historical data. Other areas have been there's nothing. So I take all the information I can get on seasonality, population, dengue incidence, etc. Bringing all that together is a key part of the preparation. In concert with that, initiate monitoring, start mapping the densities of mosquitoes or the incidence, formulate a plan, and then, as well as doing that, you'll be sort of building up your production capacity and your distribution capacity. As I mentioned before, community engagement will be going on all the time as well. And as you reach the point of starting to want to release, we would see deployment of conventional control as well to work in combination with our system, because we don't believe our system should be used purely on its own. Moving on to intervention, so this is release of males, and it's all about releasing sufficient of our males to outcompete the wild population in order to achieve suppression. Integral to the intervention phase is also a very good monitoring. This is to establish the ratio of our released males to wild males, and also the mating success of our males, and I'll come on to how we do that. And based on that monitoring, we're able to adapt the release numbers. So adaptive management is a key part of how we see these programs working. So if we're not achieving the parameters we think we need, we could increase the release rate and manage a program that way. Once we've achieved suppression, we'd move on to the cleanup phase. And here it's about continued release rates, but because the wild population has dropped, the numbers that you have to release is also correspondingly lower, so we can have a lower release rate. And this is all about just mopping up those last remaining pockets of wild population, and also depleting the egg bank. So with Aedes, the eggs they're quite hardy and they can stick around for months and months, so it's about depleting that egg bank. And maintenance phase, you've done all the hard work, you've got suppression, you want to keep it that way. And it's all about preventing resurgence, which could be through immigration or through small pockets that you weren't able to eliminate at the time. And, I mean, this strategy is based on sterile insect, which has been around since well over 50 years in agriculture. So we can borrow a lot of the strategies from there. And there's three main approaches. One is sustained area-wide release at low level. And that's a sort of preventative strategy, so that if there's any reinfestation, it's sort of knocked out before it can take hold. There's another approach is sort of more targeted strategic, so you're not releasing all the time and in all areas, but you would target it. For example, temporarily you might target, if you have a lot of seasonality, you may pick a certain time of year where you'd want to target releases. Or spatially, if there's areas of reinfestation, for example, a port or a boundary with an untreated area, you may target releases there. And then there's also the responsive. So you stop releasing, but have a good level of monitoring so that if you spot resurgence, you can respond. And that response can be a combination of both the sterile male release and also other conventional methods. And there's a sort of trade-off between increased monitoring and numbers of release. The better your monitoring is, the less you have to release on the less you have to rely on the preventative release. So, as I mentioned, monitoring is key. These are different life stages, and you can monitor all these life stages. This sort of immature larval pupal stage is one of the most popular methods with many vector control groups, but this doesn't often reflect very well what the actual adult population is. And we're interested in adult populations; those are the ones which transmit dengue. So the two monitoring systems which we use are adult monitoring, and the reason for that is because we're releasing males, we want to understand the ratio of our released males to the wild males. And in order to do that, we need some sort of adult monitoring system which will allow you to do that. And we've used both aspiration and BG sentinel traps. Aspiration is very labour intensive, so I tend to prefer the BG sentinels if it's possible to use those. The other main monitoring is OV traps. They're very cheap, they're very sensitive, especially when you have low populations. And they have the added benefit that because we introduce a fluorescent marker to our gene, we're able to recover the eggs from the OV traps and check for the mating fraction. And this is the real indicator of how well you're doing. You know, if you're getting 50% of the eggs are fluorescent, that means the subsequent generation, 50% won't develop. So you're on course for getting suppression. Put those two together and you can get information on the mating competitiveness of your released males with the wild males. Just to break that down a bit further, in a program we'd rely on OV trapping for all the phases. And it's only during the intervention phase when there's a lot going on and you need to have the adaptive management I was talking about, that you would have more intense monitoring. So during this phase, you'd have the adult trapping. Now, adult trapping is much more expensive, so it's not practical to use adult trapping throughout the whole program. And adult trapping would concentrate just on this phase. And what that gives you within 1 to 2 weeks of initiating release is a very quick kind of ballpark feeling of, are you releasing the right numbers to tackle the problem? And if you're not, you can make a quick adjustment. The next thing that you're able to detect after about 4 to 8 weeks is the fluorescence ratio you're achieving. In other words, the proportion of females that are mating with your released males compared to the wild ones. And we aim for about 50% or more, and if that's on target, we should be getting suppression within 4 to 6 months. And that's picked up by the AV traps, and then we can move into the cleanup phase. So these are the studies we've done so far. The initial ones have been published, so I won't concentrate too much on that. I just want to talk about the 2 more recent ones and bring out various elements of the field studies and how that informs operational deployment of this technology. So these are both conducted in Brazil. We're working with, I mentioned before, University of Sao Paulo and Moscomed in a project called PAT. It's in the northeast of Brazil, state of Bahia, and we've been working in a city called Juazeiro. And we've been looking at various aspects. First, transferring the technology, also conducting biosafety and behavioural studies that can inform dispersal longevity, mating competitiveness, and demonstrating the ability of this technology to suppress wild populations. So the first of the studies is going to be in Anita Barber, which is a suburb of the city of Juazeiro. Now, when we first went to Juazeiro and talked to public health people, they said, if you want to find mosquitoes, you go to this place. It's the worst of the worst in Juazeiro. So it's a very densely populated area, relatively poor, not very good water supply, so people have to rely on stored water. All that adds up to Aedes paradise and a really difficult challenge to control mosquitoes. So our treatment area here in red was about 11 hectares with just under 2,000 people. and we matched it with a control area here, which is larger and more population. What I'm showing you here is some results from a phase before we achieved the desired release rate. Now, because we're releasing males, we're actually able to monitor the adult standing crop, so the actual adult population. Most other monitoring methods rely on indirect measures of adult population, and that has been a problem in monitoring Aedes for a long time. But because we're releasing mosquitoes and we know the numbers we released, we can use marked release recapture statistics to calculate the actual numbers of male and female mosquitoes. And those are the ones that transmit dengue. So this figure here, we can see we have pretty high levels, and then when the technology started to get hold of the population, it crashed quite dramatically, and this is, after we've achieved suppression. We're able to achieve an 85% suppression in the adult population, and if we look at it in terms of ovitrap index, which is another measure, is 79%. Either way, it's a pretty dramatic reduction in the population. And again, just to mention, this isn't a seasonal effect. This is an actual reduction. The dotted line are the numbers released, and we did actually go up pretty high. But if you look at this phase here, this is when we actually started to get control of the population, because it sort of coincides with this reduction. And the way the technology works is there's a bit of a lag between achieving the release ratios you need before you see a reduction in the population. Another thing we can get, because we've been able to calculate the actual adult population, is to sort of look at the dengue transmission threshold. Now, to date, the best work on estimating dengue transmission is work by Fox et al. And in the publications, they work on a pupil per person survey, but you can use calculations in those papers to estimate what the dengue transmission threshold will be in terms of adult population, which is what I've shown here. And there's three lines dependent on different levels of herd immunity or seroprevalence. And you can see even in the sort of case where you have a totally naive population, we were able to suppress the population way below that level. So the ultimate aim obviously is about controlling dengue, and these data would suggest even in the worst part of town, which was not isolated, we're able to achieve that. So then moving on from that, we worked in Mandacaru, the results I showed earlier today. This is a village of about 3,000 people in the same area, but the difference is it was isolated in terms of Aedes habitat. Aedes is very tightly associated with human inhabitation, and this means that if you achieve control, you don't get the issue of immigration from neighbouring areas that you had in the previous studies. We also had two villages matched in terms of types of building, etc., in the same area, both isolated as well, with similar underlying mosquito population levels. So as I said, these are the results I showed earlier, but I just want to expand a little bit more what we did in this study in Mandacaru. At the top here, it shows ovitrap index, and we monitored for just over a year. And there's two lines actually, there's a dotted line and a solid line, and we treated both the north and south of the village, and we started in the south just a bit before the north. But then we started releasing, as you can see here, and achieved this dramatic reduction in the population. And we're able to maintain that reduction. Now, the figure of 96% reduction in the adult population is calculated from marked release recapture statistics, so we can only do that when we start releasing, so it's the difference between here and here, before and after treatment. As I mentioned, we had control sites, so just to show this isn't a seasonality effect, from here to here is a year, so this period here would correspond with this period. And also we've got these two villages which were matched in terms of habitat and mosquito population. You can clearly see there's no drop-off in mosquito population here, so it's a very clear result. We were able to achieve good control here. The other thing we were looking at in this study was to utilize seasonality. So we went in just towards the end of the mosquito season, and we're able to achieve control and then maintain that going into the following high season. And you can see here we've kind of indicated the release rate by shading. So we started during the intervention phase with high release rate, and then when we'd achieved a good level of control, this dropped down substantially, and we were able to maintain control with a much lower release rate. So to give you a summary of the results where we've been looking at suppression specifically, in the Cayman, just to say, these are relative ovitrap index. So we looked at the ovitrap index in the treated site relative to untreated control, and this enables you to remove the seasonality factor. So in Cayman, we achieved 82% reduction. In Anita Barber, an 81%, so very similar, two different habitats, very different, different countries, same type of result. Both these studies were non-isolated. They were immediately adjacent to an untreated area. So we believe, both in terms of time, we had to stop the study before we achieved suppression, and due to immigration, because they're relatively small areas. If it wasn't for those factors, we could have continued to get more suppression. If we look at Itabaraba, this is relative ovitrap index compared with those two control villages. We achieved greater than 90% reduction. And this is a situation where you don't have the issues of immigration. Now, these studies they are studies, and they've been concentrating on just looking at our technology on its own. But we believe this technology worked very well integrated with other control systems, insecticides, for example, and also combi, where you reduce breeding sites. Borrowing from the historical experience in agricultural SIT programs, one of the most effective combinations of conventional control and SIT control is to use conventional insecticides and other methods to really bring down the bulk of the population. So you would do that just before or just during the initiation of the releases. This takes out, as I say, the bulk of the population. And then where our technology really comes into its own is bringing down that last remnant of the population right down below the disease transmission threshold. And that's an area that is very difficult to achieve with conventional control. Also, as we showed in Mandacaru, you can bring it down to low level and maintain it there, whereas in many other situations, you're not able to maintain sustained control, so you just have to have sort of firefighting with insecticide and other methods. Just a brief thing about behavioural studies. So along with these studies designed to demonstrate suppression, we're also looking at some other aspects. Here we did some marked release recapture to look at dispersal of the released males, and it's just a bit of a model of where they go. And they disperse roughly 100 meters. A few go a bit further, but that's kind of the range you have. And that helps inform us, enables us to model where the mosquitoes would go when you release them. This black line is the release track, and helps inform how and where and when we should release. So as I mentioned previously, the beauty of this is the males do the hard work for us. They've got the little wings and they go out and find females. That's what millions of years of evolution have equipped them to do. So, we would release along a track with release points or continuous release. These days we do it from the back of a moving truck, so it's a very quick process. The Manda Karoo, village of 3,000 people, it's about half an hour of release once you get there, so it's not a long process. And during the intervention, it's between 2 to 3 releases per week. Another unique feature of this technology is the inclusion of the genetic marker. And that allows us not only to know where the males have gone, but where the gene goes, which is a combination of male dispersal and subsequent female dispersal. And from a regulatory point of view, this is a very useful trait because it allows us to have a real good knowledge of where the genes are going in the environment. And actually, our data shows that they don't spread too far. I mean, about 200 meters is the extent of the majority of the releases. The majority of the dispersal of the genes. So now coming on to more practical things. It's all very well in sort of demonstration trials, collecting data, analysing it, but to make this work on a large scale, we need a really good data management system. I won't go through this in detail, but just to show you there's various elements. There's a production, there's a monitoring the field, and also releases. We've got to know where and when you've released. This all has to be brought together and managed in a easy to access interface, and integrating with mapping is key to this. So this is an example where we can see a summary, high-level summary of the ovitrap results from Anita Barber. The red would be the numbers of fluorescent traps, for example, and you can sort of drill down, look at individual trap catchers, click on those, look at the data from those. So an integrated data management system, I think, is key to making this work on a large scale. So now moving on to Jackabena, the project we're currently working on. It's a real step up in terms of scale. It's a city of 50,000 people. Had a really, and still does, high incidence of dengue. I mean, they had an outbreak in 2012 where just under 50 cases per 1,000 were reported, which is, those of you who know about cases, that's a very high level of outbreak. It's also 3.5 hours drive from the main laboratories and the main mass rearing facility, so we're able to test issues of distribution and logistics, transporting the male pupae from there to the local field station, enclosing those and doing releases. And this work started in June 2013. So how do I go about it? I've got this city of 50,000 people. The first thing is to map the inhabited areas. As I mentioned before, Aedes is very tightly associated with people and where people live. So the first job is to map the inhabited areas. Then we subdivide. It's too big a job to tackle all in one go. So what we did in this instance is subdivide by suburbs or barrios. And I used the same divisions that the local vector control team used and the public health team used, so that I could utilize the historical data for each individual suburb. And also there was demographics on human population, all the sort of stuff that we need in order to plan a rollout and control program. Then we deployed traps, in this instance about 400 ovitraps. And from that, we're able to get an idea of what the incidence of the mosquito is in all these different areas. And as you can see, it varies greatly. I mean, these red areas are very high ovitrap index. These green areas, you have a much lower ovitrap index. And in order to roll out this strategy for a city, we don't try doing the whole city at once. We've broken down, bite-sized chunks. And then we work out initial release rates for each one of those suburbs, which are tailored to the mosquito infestation. And this judgment is based on on a variety of data, including our OviTrap data, any historical data, human population density, seasonality, and things like housing type, water supply, that sort of thing. To simplify the process, we kind of categorize areas as being high, medium, and low in terms of mosquito infestation. And that's how we go about starting and planning a program. Now, in this particular project, we're starting smaller with 2 to 3 barrios, and as we achieve control in those areas, we'll free up more of the mosquito production, to move on to other areas. At the same time, the facility that we've got in Brazil is new, so we're also increasing the production capacity. So in conjunction with increasing capacity and the control you achieve, we plan to roll out across the city, starting in the northwest and moving across. So the results to date, I showed you this beforehand. We had the adult monitoring demonstrated we're achieving an overflooding ratio required. We've got the good overflooding ratio. Within 4 weeks, we got up to over 50% mating fraction, and we're able to sustain that. And we're just coming up to 4 months, so I expect to see very soon signs of the population starting to drop off. The other thing that increasing in scale allows us to do is to start to look at dengue epidemiology. And those of you who know about dengue epidemiology, it's not an easy thing to do. There's different serotypes, and you have issues of seasonality, etc. Previous studies have been far too small to look at epidemiology. This study is at the threshold, I think, of where you should be able to start to see some data, although depending how into the statistics you get, the larger the better. But we are working with the public health authorities. We're tracking dengue incidents, and we can do that by barrier as we move across, by suburb as we move across and do the rollout strategy. The Brazilian authorities are also conducting seroprevalence study in areas which have been treated, and comparing it with untreated areas and seeing if we can detect changes there. And so we believe we should start to get some indicative data. So as far as this technology and the next steps, I think we're working in various places. The lead ones at the moment are Brazil, US, Malaysia, India, and Panama, and we're talking with other people as well. In terms of technology, as with lots of technology, there's lots of room for optimization, streamlining, etc. One of the key areas is automating the release device. Another thing I think we really want to concentrate on now is integrating with other vector control methods. I think that's a key aspect of using this technology and making it usable, and building and optimizing this data management mapping system. And with scale, you get increase in efficiency, and you will also be able to start generating more epidemiological data to look at the effects on dengue transmission. So with that, I think I can